There's a pensive mood in Mpondwe Market, southwestern Uganda. A Congolese fishmonger who visited the market to buy fish for trade died of Ebola when she returned home. She came by road on a motorcycle, was a regular here and interacted with many people. Health workers are looking for several high-risk contacts, some of whom are said to have gone into hiding. MASINGA NYAMUMBERE, who knew the woman, does not believe she died of Ebola. It's a belief many people also share, complicating government efforts to deal with it.
She was pregnant and she had a miscarriage. Everyone knows that. People who touched her have not died yet. Why are you saying she had Ebola? Women bleed when they have a miscarriage. That's what we know.
This is one of the busiest trade routes between Uganda and the DR Congo, but the border is porous and many people use informal crossings to get from one country to the other.
If someone comes to the market, how are we supposed to know the route they took? Not everyone uses formal crossings.
The World Health Organization has now declared the Ebola outbreak an international public health emergency. This was based on the high risk of the disease spreading across the region, the fact that it's still flaring a year after it started, and the incredibly volatile security situation health workers are working under. Health workers we've talked to say the declaration could not have come sooner. They want more logistical help and money. They're also dealing with local communities that don't trust them and in areas where militias have been attacking them, as well as Ebola treatment centers. Up to 10 health workers have been killed since the outbreak began a year ago.
The security is a main pillar where, people have expertise, will work with the community. But I think the first really security measure is to really get a point where the community itself will protect Ebola health workers. That's why the community engagement is capital for this.
For now, the focus is to make sure that Ebola does not spread in Goma, a strategic city, after a preacher who tested positive of the disease died, and to regional countries or other parts of DR Congo. Catherine Soy, Al Jazeera, Nairobi.